Have you ever noticed your breath making a strange sound, perhaps a faint whistle or a high-pitched squeak, and wondered what it meant? These unique sounds from your lungs can often tell us a story about your breathing health, and for those with chronic obstructive pulmonary disease, or COPD, they can be a very common sign. Chronic obstructive pulmonary disease frequently causes wheezing sounds because it leads to the narrowing of your airways, making it harder for air to move freely in and out of your lungs. This narrowing creates turbulence in the airflow, producing that distinctive whistling or squeaky noise that you hear. The primary reason COPD impacts your airways this way is due to chronic inflammation and increased mucus production. COPD encompasses conditions like emphysema, which damages the air sacs and small airways, and chronic bronchitis, which involves inflammation and excessive mucus in the bronchial tubes. Both of these components constrict the passages where air travels, acting like a bottleneck in a pipe. As you breathe, especially when exhaling, air gets squeezed through these tightened spaces, vibrating the airway walls and causing the wheezing sound. Recognizing when you are wheezing can be an important step in managing your COPD symptoms effectively. If you experience new or worsening wheezing, it is always a good idea to speak with your doctor or healthcare provider. They can assess your symptoms, adjust your treatment plan if necessary, and ensure that your COPD is being well managed with prescribed medications and therapies. It is also helpful to understand that wheezing in COPD often occurs more prominently during exhalation, known as expiratory wheeze, because the airways naturally narrow a bit during this phase of breathing. This specific timing can sometimes differentiate COPD-related wheezing from other respiratory issues. Staying vigilant about your breathing patterns and any changes, like an increase in wheezing, can provide valuable clues about your lung health. By understanding why COPD causes wheezing and what those sounds signify, you empower yourself to better monitor your condition and communicate more effectively with your healthcare team. Being aware of these breathing changes allows for timely adjustments to your care, ultimately helping you maintain better lung function and improve your overall quality of life.